You know, sometimes you just have to do what you want to do for you, no matter how old you are, and regardless of what anyone else might say.
Sometimes you just know what you want.
That's how it was for Carol Visconti, who decided she wanted to get a facelift at the age of 74 to celebrate her new freedom in retirement.
We met up with her the day after her operation and just recently to show you the final results. So you just came out of surgery. How are you feeling?
I do feel a little tired because it does take a while, but I do feel good. I'm not in really any pain or anything. There's a little discomfort, of course, because it feels a little warm maybe, but not painful.
Yeah, and you're able to talk, you're drinking something, and you got it all done right here.
Yes, I did. I got it all done here.
Carol opted to have her facelift done at the Stanislaw Plastic Surgery Center office in Avon rather than the hospital.
When I do it here in the office, it's purely just numbing medication. There's no IVs, there's no sedation, there's no pills. It's just me going, all right, I'm gonna inject numbing medication through here, and I'm gonna inject numbing medication through here, and it does pinch and a burn as it goes in, but as it goes in, they're gonna be numb, and they'll be numb for about 8 hours.
Carol's procedure took about 5 hours, and she was awake the whole time. If you're squeamish about needles or can't sit still, it may be best to get the facelift at the hospital under anesthesia.
You have to plan ahead what you're going to even bring with you when you come, and to be comfortable. The staff is wonderful, and obviously the doctor is great, and not just because he's standing here, he is great. No, that is true. Very thorough, and he definitely is fussy about his work.
And people want a natural look. You can get that?
Yes. Mm-hmm. Yeah. So the goal here is nobody wants to look operated on. Everybody wants to look natural. They just want to look like themselves, just a little bit younger, more awake, more rested.
Carol knew she trusted Dr. Paul Stanislaw to give her a natural look since she's been coming to him for quite a while and has done other procedures like fillers and a mini facelift before.
Now this is, of course, my last thing because I'm of my age. This is about it. This is as far as I'm going to go, probably.
Are you going to share your age with
74.
74!
So, you know, how much, this is going to last 10 years, I guess that's going to be it. But the one thing I would like to say is to all women, if you don't like where you're at, if you're not happy with your nose or your eyes or anything, do something for yourself. Don't listen to anybody else, because people are always going to tell you, oh, you look fine. But you go in the house and then you look in the mirror and what do you see? Your neck or your lines or your eyes. And we all do it. We all do. I know some don't admit it maybe, but they do. Do something about it.
So it's been just over a month, about 5 weeks.
5 weeks, right?
Since we've seen you. You look great.
Yeah, it is. I feel great, and I'm very happy with his work. It wasn't difficult at all. It was like I was saying to them, it's not painful. It's sore in the first 3 or 4 days. But after that, it's just the swelling just starts going down normally as it would. And really, it's really nothing. It's just that you don't go out, you know, because you're black and blue, so you can't go out. I think that's harder than anything, is staying in the house.
That part lasted a few weeks. Here's a look at Carol before and after her face and neck lift, 5 weeks after her operation.
The incision's sort of right here and goes here. You can see it's still a little red right through here. It's still a little lumpy bumpy, and that's all got to settle down a little bit. So again, a little bit of swelling and stuff like that, but the incision goes here, it goes under here, goes behind here, and then...
And you really can't see the scarring.
It goes right here.
Very hidden.
Yeah, this is only at 5 weeks. So it all hides very, very well.
And Carol says this was all worth it.
My granddaughter, that was the funniest, because she didn't even notice, and I said to her, well, did you notice my face? And she's, what? And I said, because she's 12, and I said, my chin. I don't have my turkey neck anymore. She goes, oh, you don't? Wow. I said, abracadabra, all gone.
She still has a bit more healing to do, but Carol's back to her daily walks and loving retirement.
I'm very happy I did it. In fact, I found out that people even older than myself have things done, so this was like my last hurrah. Maybe it isn't. Maybe, who knows?
Good for her.
She's a hoot. It was great to meet Carol, and she was very candid, and it was nice to see the before and after to really understand what happens. For more information or to schedule a consultation with Dr. Paul Stanislaw, you can visit stanislawmd.com.
All right.